Hello, I'm Dr. Leonard Matheson. Welcome to another lesson on work-oriented neurorehabilitation, brought to you by Epic Neurorehabilitation and Psychology Services in Chico, California, along with Matheson Development in Corvallis, Oregon. In this lesson, we're diving into a crucial cognitive ability variable from the ONED framework, oral comprehension. Understanding this variable will significantly enhance your ability to assess, treat, and facilitate a safe return to work for your patients. Oral comprehension is a crucial ability for our clients who are returning to work after a concussion or stroke, and for many other causes. It's a limitation that the client can hide from their employer because they are embarrassed, and it may only break down in highly complex interactions. Unfortunately, that's precisely when trouble arises and can produce catastrophic results for both. Let's begin with a clear definition. Oral comprehension is defined as the ability to listen to and understand information and ideas presented through spoken words and sentences. It's not just about hearing sounds, it's about processing those sounds into meaningful information. Think of it as the brain's internal decoder for verbal input. To grasp its importance, consider occupations where oral comprehension is paramount. Imagine an air traffic controller. Their entire day revolves around listening to pilots' instructions, emergency calls, and weather updates. A misinterpretation, even of a single word, can lead to catastrophic consequences. Similarly, a surgeon in the operating room relies heavily on understanding verbal cues from the anesthesiologist about a patient's vital signs, or from nurses reporting critical changes. Or consider an emergency dispatcher fielding frantic calls. Their ability to quickly and accurately comprehend the caller's distress, location, and the nature of the emergency is life-saving. Even a customer service representative needs strong oral comprehension to truly understand a customer's problem and offer a relevant solution. In all these roles, the rapid and accurate understanding of spoken information is not just important, it's absolutely critical for safety and performance. Now, let's differentiate oral comprehension from some closely related ONED abilities. Two that often get confused or are seen as intertwined are oral expression and selective attention. First, oral comprehension versus oral expression. Oral comprehension, as we've discussed, is the input, listening to and understanding spoken words. Oral expression, on the other hand, is the output, the ability to communicate information and ideas in speaking so others will understand. While both involve spoken language, they are distinct processes. A person might have excellent oral comprehension, meaning they understand everything said to them, but struggle with oral expression due to a motor speech disorder or aphasia, making it difficult for them to formulate and articulate their thoughts verbally. Conversely, someone might be highly articulate, strong oral expression, but have difficulty processing and understanding what they hear. When you observe a patient, you'll want to assess both independently. Can they follow your multi-step verbal instructions, comprehension? Can they then verbally explain a concept back to you? Next, let's look at oral comprehension versus selective attention. Selective attention is the ability to concentrate on a task over a period of time without being distracted. While strong selective attention is often a prerequisite for effective oral comprehension, they are not the same. You need to attend to spoken words to understand them, but simply attending doesn't guarantee comprehension. Think of listening to a lecture in a language you don't understand. You can selectively attend to the speaker's voice, ignoring other sounds, but you won't comprehend the content. In the clinic, a patient might demonstrate good oral comprehension in a quiet, distraction-free environment, but if you introduce background noise or multiple simultaneous auditory stimuli, their performance might drop. This suggests a challenge with selective attention impacting their oral comprehension rather than a primary deficit in the understanding of the words themselves. If they struggle to understand even in a perfectly quiet room, it points more directly to a core oral comprehension issue. So how can you, as an occupational therapist, differentiate and identify oral comprehension during patient observation and assessment? Provide multi-step verbal commands. Start simple, then increase complexity. Observe if the patient consistently follows all parts of the instruction. Ask for paraphrasing or summarization. After giving a verbal explanation or a short story, ask the patient to explain it in their own words. This directly assesses their understanding, not just their ability to repeat. Use questions that require inferential understanding. Beyond basic recall, ask questions that require them to make connections or draw conclusions from what they've heard. Vary the environment. Test oral comprehension in both quiet and moderately noisy settings. If performance significantly declines in noise, it might indicate an underlying selective attention issue that impairs their ability to effectively use their oral comprehension. Look for nonverbal cues. Do they appear confused or ask for repetition frequently? Do their actions align with your verbal instructions? Finally, let's consider the dire consequences when oral comprehension is impaired, especially after an illness or injury leading to tragic accidents or catastrophes. Imagine an experienced airline pilot who returns to work after a bout of severe illness, perhaps a stroke or a viral infection that subtly affected their cognitive processing speed, specifically their oral comprehension. They might still be able to fly the plane skillfully. However, during a critical approach in heavy traffic, air traffic control issues a rapid sequence of complex instructions regarding altitude, speed, and holding patterns. Due to their impaired oral comprehension, the pilot misinterprets one crucial instruction, perhaps hearing descend to 5,000 instead of descend to 3,000, or misunderstanding a runway clearance. This small misinterpretation, stemming from a deficit in processing spoken information, could lead to a catastrophic mid-air collision with another aircraft or a dangerous runway incursion. The pilot heard the words, but the meaning or the full context of the meaning wasn't correctly processed, with devastating results. Here's another example. Consider a senior nurse returning to their demanding role in an intensive care unit after recovering from a severe concussion. They might feel physically ready, but their oral comprehension is subtly compromised. During a rapid response situation for a deteriorating patient, the attending physician verbally gives a series of precise medication orders and procedural instructions. The nurse, due to the lingering effects on their oral comprehension, misunderstands the dosage of a critical drug or misinterprets the physician's instructions regarding a line placement, leading to an incorrect medication administration or procedural error that causes irreversible harm or even death to the patient. These scenarios highlight the critical importance of a robust oral comprehension ability in high-stakes professions and underscore why a thorough occupational therapy assessment of this skill is absolutely vital for ensuring patient safety and successful, safe return to work. To help screen for clients' oral comprehension limitations in a work setting, Epic Neuro has developed the Dynamic Complex Assessment Task, also known as DCAT-2, based on the doll chair assembly task. This allows us to track our clients' progress as they participate in work-oriented neurorehabilitation. To support the DCAT-2, we have developed the Occupational Task Ability Profiler website, also known as OTAP. These are sample screens from OTAP. The first comparison assesses the client's behaviorally anchored rating scale scores against the demands of their occupation, specifically for a physicist. The second screen helps us interpret our behavioral observations and link them to the Occupational Information Network. It's a tremendous resource that we hope you will embrace. We find it very useful. So thank you for your valuable time and attention. I hope you found this useful and will continue to explore how we can enhance our abilities to support our clients, particularly those in high stakes or potentially hazardous jobs, in safely and reliably returning to work. If you have comments or questions, I would be delighted to hear from you. I can be reached at this email address, len@mathesondevelopment.com.